I'm Raul Pino, Commissioner for the Department of Public Health, and we are here, thanks to the Governor for being here with us, Director Andreades. We would like to give you an update on the numbers on our Zika testing and infection, and also about a new system that we are putting in place to potentially detect cases that may not have been related to travel. So far, we have tested 472 individuals. We have resolved for 373. We have confirmed 31 cases. 3 of those are pregnant females. And we are also expecting results in a number of females that we have not received those yet, because we double run test on females to be able to confirm. Because of the recent events in Utah, where there's a transmission that has been of renown, how it was transmitted, and the recent case in Florida where they believe local transmission has occurred, the Department of Public Health have decided to establish a sentinel system in the southern part of the state. We are basically coordinating with community health centers, hospitals, and emergency rooms. And we are going to, each site is going to test approximately 10 individuals each week that have not traveled to the areas where the infection has occurred, but that may have symptoms that could be potentially linked to Zika, rash, conjunctivitis, muscular ache. And the idea is that we are looking to potentially catch cases that may be related to local transmission, either by mosquito or sexual transmission. Now, in Connecticut, we do not expect mosquito transmission to occur, but sexual transmission could potentially occur. So those sites will be testing approximately 10 individuals each a week from individuals who are older than 16, females and males, and the sites were selected based on the presence of, in the past, of Albopictus, the secondary mosquito that could transmit infection, and also in the ethnic composition of the residents of the area that may be linked to the areas in the Caribbean and the Americas where the transmission is occurring. Again, we are looking for potentially sexual transmission, and if it happens, which we do not believe it will happen, transmission links to the mosquito. We do not have any, not foresee any budget issues for us to be able to perform these activities. We support from the governor and the federal government. We have applied for approximately more than $900,000. We have received already 322, and the other applications will be forthcoming in the near future. With that, I would like to introduce the governor.
Thank you, Doctor. I very much appreciate your taking all my lines. No, this is, we have promised since January when learning of this possibility that it would come to our shores, instructed the commissioner to set up a team to help us address this and to stress public information being exchanged on a regular basis. So this is one of those opportunities for us to let you know what we're doing. Now, we are testing all over the state, but the Asian tiger, which is how I'll say it, a mosquito, is present in Connecticut and has showed up in 3 tests. Now, that's not that. We expected that. We told you that the Asian tiger mosquito is in Connecticut, and that we expected to have it. Now, that is a secondary vector, so it's a secondary carrier. It's capable of carrying the virus. It has carried it in Asia, so obviously we want to monitor where that is. And the sentinel system that the doctor has described will correspond and will enlarge or shrink depending on where we find the Asian tiger mosquito. We'll work with the local hospital in that area or those areas to be involved in the sentinel screening. Again, this is precautionary. We don't, it's not a primary vector. We're not the home of a primary vector, as opposed to a Florida or some of our southern states that have both types of mosquitoes in their presence. Secondly, I've said that we'll make the money available. This is an emergency situation. We do look forward to receiving some money from the federal government. I hope that that's the case. I hope that in Washington they can get out of their own way, although they're not working for weeks on end. But hopefully they'll send us some money, and if we have to advance additional money for screening or other activities, perhaps it will be reimbursed that way. But we'll make the monies necessary to continue our screening regimen as we've had it in the past. By the way, we also have seen West Nile in the state, and so the same precautions. Bug spray is the best way to do it. Long sleeve and long pants, particularly in the hours when mosquitoes are most active, makes a lot of sense. Protecting children makes all the sense in the world. So whether you're trying to make sure you're not exposed to West Nile or a bad mosquito bite, take the steps necessary. Again, I think you're going to say a few things, Doctor. I'll turn it over to you. I think I have most of that right. Did I memorize it on the way down? So I'll turn it over to the doctor, then I'll take a few questions on point. Okay, Doctor.
Thank you. I'm Dr. Theodore Andriadis. I'm director of the Agricultural Experiment Station here in New Haven. I'll give you a very brief update on where we stand with our mosquito trapping and testing program. We started the program at the beginning of June, and we're trapping at 91 locations throughout the entire state of Connecticut, as we do each year. Thus far, we have trapped and tested over 90,000 mosquitoes that are collected in the state. These come into our laboratory on a daily basis. Thus far, we have found no mosquitoes infected with Zika virus. However, we have already detected one batch of mosquitoes infected with West Nile virus. These were collected in Stamford. This is totally anticipated. We are entering the West Nile virus season. I know there's a lot of concern with the possible introduction and establishment of Zika in the state, but we can't lose sight of the fact that West Nile virus is here. It reemerges every year. To date, in the state of Connecticut, we have had 130 cases of West Nile virus with 3 fatalities, so it's not something to be taken lightly. Last year, we had 10 human cases, and the hotspot was Bridgeport. I anticipate in the coming weeks, especially with the hot, dry weather that we're experiencing, that there will be a buildup of West Nile virus, so you can anticipate that we're going to be reporting more infected mosquitoes. As the governor indicated, it's very, very important that the public take the necessary precautions to protect themselves from mosquitoes. This will protect them not only from West Nile, but also the potential infection with Zika virus. Concerning Zika, we have specialized traps that we are using in coastal Fairfield and New Haven counties and some of the areas where we know we have populations. They generally occur in coastal communities extending from Greenwich up to New Haven. That is the principal area where this mosquito occurs, and as the governor and the commissioner have indicated, we are not anticipating local transmission by mosquitoes, but we are testing these mosquitoes on a daily basis. And that's currently where we stand with our program.
Well, that will take some questions on point, and then I'll handle some other things for you. Yes?
Of the cases you have confirmed, are any of them men who contracted the Zika virus?
Oh, yeah.
I didn't hear the question.
Are any of the
What's
confirmed Zika cases men?
Yes.
What's the gender breakdown?
I don't have the gender breakout, but we can provide it to you right now. I don't have it. Yes, absolutely.
And again, these are travel-related cases, and we know that some of the territories and island nations in the Caribbean are very adversely affected. So what we're seeing is people coming back from those places so far.
What's the status of the individuals?
Also, in our webpage is by country, by gender. So you can find it right there right now if you want to.
What's the status of treatment?
Well, I should clarify that these are accumulative cases. It doesn't mean that we have that number of cases right now. It means we have those number of cases since we've been tested. testing. So, I mean, all the cases are all the individuals are in good shape. They get treated. The disease doesn't have major consequences for the individual. It's mostly for babies, unborn babies, and birth defects, and those are major concerns. We have established a registry for pregnant women who have contracted the disease, and we also have a registry in place to track babies after they are born. So far, no one has been born with any birth defect.
So to confirm, the additional 10 people testing, that is basically to look for sexual transmission. Is that what you're
It will look for local transmission. There are only two ways that local transmission can happen this far, if nothing else is discovered. It's either by mosquito or by sexual transmission. We do not expect mosquito transmission in Connecticut. If local transmission were to occur in Connecticut, more likely will be sexual.
Yes.
Governor, for our residents who are concerned about this latest news in Utah and in Florida, what is your message to them tonight?
Well, the Utah case is, I think we're all looking for an explanation and try to understand how that may have happened. We do know that sexual transmission is common, so that does not appear to be the case, and I think everyone's examining that case in Utah to try to understand how that may have happened. Whether there was exchange of, fluids or coming into contact with a wound or that sort of thing, so that people are trying to understand that. With respect, again, we don't expect a mosquito-borne illness, but we are going to test it on an ongoing, constant basis during the mosquito season because we have that secondary vector. And obviously, we have hundreds of people who've had the virus in our state. It's possible that it could, but not expected that it would be transmitted by the Asian tiger in Connecticut. The Asian tiger has been common. It's not the most common, but it is a common mosquito in Connecticut. It's showing up exactly where we thought it would show up. And people should take precautions at their homes, around their homes, to make sure that there's not standing water. It's a mosquito that is an urban dweller, in the sense that it doesn't need a large body of water to breed. So just take common sense precautions to protect yourself. So I think what the real message is that we're being very diligent. We're doing the testing, and the resources necessary to continue that process are at hand, and we are applying to the federal government for additional assistance. The Congress has not appropriated money yet, but having spoken to Leader Pelosi and having spoken to some Republican leaders in the Senate, we're hopeful that when they return, they'll make those monies available.
Can you tell us more about the testing? How many centers, how many hospitals throughout the state will be involved?
Well, right now, 3 hospitals will be involved, as I understand. I have that right? Yeah, 3 hospitals. And as we find increased numbers of tiger mosquitoes in any additional areas, Asian tiger, we're capable of expanding that rapidly.
3 hospitals in Lower Fairfield and Hampton County?
2 in Fairfield County, 1 in Hartford County, right?
So right now, Bridgeport, Stanford, Stratford,
yeah.
and we are looking to engage also community health centers.
Oh, that's it. Okay.
Yeah.
Thank you.
Are other states doing this too in the area?
I believe New York City is doing it.
I think we have arguably the most comprehensive statewide approach to it right now, and this is probably the 5th or 6th time we've gotten together for these updates. I mean, I said at the outset that we would keep you all informed, and that's what we're doing, and we're going to continue to do it right through October.
Can you just kind of go over to Governor exactly how this testing is going to work at these hospital sites?
Yes, they are going to look for people who report similar symptoms to the virus, who don't say that they have necessarily been to a place where it's being transmitted, and they're going to test them for the virus. So that we're looking for any other ways that people could potentially come into contact with the virus. So it's a screening process based on primarily on where we find the tiger mosquito currently or where we expect to find the tiger mosquito. Secondary vector, we're not predicting that it's going to spread, but we're going to be diligent, and particularly since we're now, as expected, finding that mosquito in certain places where we expected to find it. This couldn't be any clearer. But that is not the primary vector. We do know it's capable, and because it has transmitted the disease in parts of Asia. Okay? All right, on other points? Anybody? Sure.
Governor, reaction, the DOJ is announcing that it's looking to block the healthcare mergers. What's your reaction to the DOJ stepping in?
Well, I think they're announcing today that they're seeking to block one of those mergers, and there's speculation that they may seek to block the other. So I've said from the very beginning that this is a long process, that it's a process that's driven by the federal government, always has been, always will be. And if they have true antitrust concerns, they're doing the right thing. You know, I think that that's the reality. They have a job to do. We've said from the very beginning that this really is driven by the Justice Department, and based on all of what's been written and speculated on over the last 2 months in particular, I'm not surprised at all.
I believe she's speaking right now, the Attorney General.
Oh, okay, all right. Well, I knew it was coming. Did they do both, or just the? I thought that.
I just saw that she's speaking.
Yeah, I thought the one that I expected that they'd be speaking on today was the Anthem Cigna transaction, as opposed to the Aetna Humana. But at least everything I read earlier today, that's what the expectation was. So, but if you need me on the other one, you let me know. Anybody else? Okay, thank you all very much. Thank you. All right, let's take a quick tour.